Hi everyone, my name is Laura Doig and I'll be presenting today on partnering with families to pursue sustainable development goals, screening for unmet social needs in paediatric speech language pathology. This is our team who worked on this project: Lauren Hamill, who is our fearless leader, Anna Kearns, myself, Megan Hesse, Dana Frederick, Alison Purcell and Sue Wolfenden. I would like to acknowledge the Gadigal and Bidjigal people of the Eora Nation, which is where our project took place in southeastern Sydney, Australia. I'd like to pay respect to elders past and present and any Aboriginal people watching this presentation. For 6 years, my speech pathology work has been with Aboriginal communities in southeastern Sydney, Australia, just a few hundred metres up the road from where this photo was taken. The children and families I worked with were resilient and resourceful, and the project I am talking about today aims to support all children and families to get what they need. I was excited to learn that this Early Childhood Voices conference platform was a chance to share research about innovative ways to partner with children, families and colleagues to support social justice during early childhood. This is what our project was all about, and it's great that there are many health professionals thinking about preventative measures to continually strive for justice. To set the scene for our project, I'll spend some time talking about poverty and about the social determinants of health. But what is poverty? So we know 1 in 6 children in Australia are living in poverty. And poverty doesn't just mean a lack of money. It also means there are unmet basic needs, such as access to safe and affordable housing, healthy food, education, employment, and healthcare. Not addressing these unmet basic needs leads to differences in children's health, development, and well-being that are unjust, unnecessary, systematic, and preventable. Australia is often referred to as the lucky country, and it is for many. But as you can see from this figure, not everyone gets the same chance at a good start in life, and the COVID-19 pandemic and associated lockdowns has only made this worse. Poverty affects an individual's cognitive bandwidth or mental resources and generates an intense focus on the right now to the detriment of the future. As such, when parents or carers of children with speech language and communication needs need to direct their mental resources towards dealing with unmet basic needs, they have less attention to devote to other important tasks, such as supporting their child's development. On a practical level, this can mean that when parents' carers are struggling to pay their rent, they might have to cancel their child's allied health session at the last minute if they're offered a casual shift to come into work. It might also mean that if there's no money to buy food, there's no money to pay for the bus to get to a therapy session. It can mean that if there isn't a stable family home, there's no way to practice the exercises or the home activity ideas that we suggest. So people can only do as well as their situation allows. And we've worked out that we can't do our job, which is to partner with families to help children reach their communication potential, if families have these unmet needs. As you all know, communication is a human right, yet not everyone has equal access to developing their communication skills due to the conditions in which they are born, grow, live, work, and age. This is known as the social determinants of health. Sadly, 2021 Australian Early Development Census data shows the gap between children in the most disadvantaged and least disadvantaged locations in Australia has widened and now is the largest gap since 2012. And we all need to work towards addressing this gap. So our team at Sydney Children's Hospital in Australia have joined the social determinants of health movement, and we'd love it actually if all health professionals, educators and students would join this movement too. We believe that everyone has a role to play in tackling inequities, and the social determinants of health movement is gathering momentum, and we'd love to sweep as many of you up in this movement as we can. So even though there is a growing body of literature, as you can see on this graph, which shows a significant increase in publications in the last 10 years focusing on the social determinants of health in health, speech pathologists have contributed very little to this literature. Speech pathologists aren't trained to ask about things like housing, food, and bills, and poverty can sometimes be invisible. So we worked out we needed to find a way to identify when families are struggling, because research tells us that if we find a way to ask about unmet basic needs, then the impact can be life-changing. Research also tells us that adopting an overarching framework for addressing unmet needs holds promise for promoting health at the individual and population level, working towards health equity and addressing many of the United Nations Sustainable Development Goals. This OASIS framework shows the basic idea. If you identify unmet social needs, address these needs, this will lead to improved outcomes. We know screening and referral pathways for unmet basic needs works. A robust RCT, randomized control trial in the US, has shown that after just 4 months of asking questions about unmet basic needs, that families were 44 times more likely to receive support, and after 12 months, mothers were likely to be employed, children were more likely to be in childcare, and the families were less likely to be homeless. But this screening is not happening routinely in Australia and not being done by speech pathologists or other allied health professionals. So we embarked on this project to turn this big problem into a huge opportunity, because as I mentioned before, it's almost impossible to address communication needs when there are unmet basic needs. The aim of our project was to examine the need, feasibility, and acceptability of speech pathologists implementing a systematic social determinants of health concerns screening tool and referral pathway as a means of promoting health equity and pursuing these 9 out of 17 of the United Nations Sustainable Development Goals. This project is about changing children's chances so that risk does not have to equal destiny. As I talk to you about our project, I'd like you all to think about your own clinical work and reflect on what aspects of this project resonate with you, which elements of this project you might be able to adopt, and what ideas you can take away from this presentation today that are actionable. We used quality improvement methodologies to adapt and pilot a social determinants of health concerns identification tool and referral pathway for use with parents and carers of children with speech, language and communication needs who were referred to Sydney Children's Hospital in Sydney, Australia. Rapid cycles were undertaken to select the tool for adaptation, develop the pathway, conduct the pilot, assess clinician acceptability and feasibility, and ensure sustainability of this work. The We Care screening tool by Garg and authors was selected as the tool to adapt due to the social determinants of health domains assessed, its paediatric focus, the length, its readability, and ease of interpretation. We partnered with a local community organisation called Family Connect and Support, who we would refer on to if there were needs identified. Family Connect and Support provides support for all social determinants of health domains included in the adapted tool, and they welcome referrals from professionals and parents or carers. And they also service the geographical boundary of Sydney Children's Hospital. Sydney Children's Hospital speech pathologists use the adapted tool as part of routine telephone intake. The tool takes less than 5 minutes to administer and consists of 6 questions. An anonymous survey was then completed by a speech pathologist, which gathered information about the acceptability and feasibility of this practice. We're currently working on sustainability. We named the adapted tool Rise Up, an acronym standing for the Routine Identification of Social Environments to Unlock Potential. Rise Up addresses 6 needs: childcare, parent-carer education, employment, housing, food security, and household bills. We completed our 12-month pilot at the end of March this year. Our data revealed that 289 of 292 families, or 99% of families, agreed to participate in the screening. 11% of families reported concerns about unmet basic needs. The most common unmet basic need for families related to household bills, followed by childcare. The majority, 84% of these families who highlighted concerns, requested referral to our or information to our onward referral partner, which was Family Connect and Support. Results from the speech pathologist surveyed indicated high levels of acceptability and feasibility relating to this work. As speech pathologists, when we address communication goals and unmet basic needs, children have a better chance of doing well at school, of finishing school, of making friends, staying out of jail, getting a job, living independently, and contributing positively to society. Speech pathologists and allied health are perfectly placed to take action and play a role in tackling poverty. Speech pathologists are often the first health professional a family sees, but we don't have the right tools. We aren't properly trained to ask about unmet needs, and we're often under a lot of time pressure. However, the findings of this pilot demonstrate that this work can be done. This is scalable, transferable, and importantly, sustainable. We think all health professionals, including speech pathologists, have a role to play in tackling poverty and addressing the social determinants of health. If children are able to sleep well, eat well, live well, and learn well, they have a much higher chance of being able to develop well. This pilot started in 2021, and we completed the pilot data in March this year, 2022. The focus for the next steps of this work includes further development of the Rise Up tool to have more parent carer input into it, expand the work to include trials with larger sample sizes across different geographical and socioeconomical locations, measure outcome data in order to provide valuable evidence in defining the role of speech pathologists and allied health professionals in this field, and also psychometric assessment of the Rise Up tool is also essential. Some other implications include we need to have some practice guidelines for speech pathologists and allied health professionals around these social determinants of health concerns, and ensure that these questions are always asked sensitively and there are clear referral pathways to support and assist families' need. The future guidelines must examine the feasibility and acceptability of such a practice change, given there are many healthcare workers who report there are a number of barriers to screening for the social determinants of health. So I'm keen for you to reflect on this presentation and consider what you'll take away from this session, and how you can make a change in your own workplace that strives for justice. We want you all to join the social determinants of health movement and think about the important role you play in a family's life. Can you think of a family that you work with that you would benefit from this work? Do you know what resources are available in your area to support families? Could you consider a social determinants of health identification tool and referral pathway in your setting? And have a think about your service and the population you serve, and let's all work towards tackling health inequities. So I feel like we use this picture a lot, but our profession can keep going as we always have, or we can recognise that the social determinants of health are a significant factor that affect children's ability to reach their communication potential. And I feel like that is across the board with all of allied health, not just speech pathology. This is a podcast that my colleagues Anna Kearns and Lauren Hamill spoke about, screening for basic unmet needs in paediatric speech pathology on Speak Up. If you'd like to listen, it's great. A few acknowledgements. I would like to acknowledge the dedicated work of our team: Lauren Hamill, Anna Kearns, Megan Hesse, Dana Frederick, Alison Purcell, and Sue Wolfenden. Lots of people give up their times outside of their work hours to get this work off the ground, so we would really like to acknowledge that. We'd also like to acknowledge the Speech Pathology Department at Sydney Children's Hospital Randwick and Family Connect and Support for their continued support with this work. And most importantly, we would like to thank the children and families that we are privileged to work with. Thanks very much.